From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, March 15th. I'm Mark Boyle. Your dental cleaning could soon come with a vaccine. WRAL's Leslie Moreno shows us the process and why dentists could face hurdles in helping with the response.
To help vaccinate more people, dentists like Dr. Michael Riccobeni are now among the many who can help.
Did I expect to be giving a COVID vaccine? Absolutely not. But am I up for the challenge? Do I think it's the right thing to do? Am I motivated to do it? Absolutely.
Bobby White with the North Carolina Dental Board says dentists will have to complete an online course provided by the CDC first.
Probably the way this will be most beneficial to dentists is that dentists could become vaccinators at vaccination sites through the public health department or through a hospital situation or something like that.
Dentists also have the option of being a provider where they can vaccinate in their office. This has to be approved by the CDC. This is what Dr. Riccobeni is currently in the process of doing for about 5 of his locations.
If we're going to go through the training and the expense, we want to be able to reach as many people as possible.
Dr. Riccobeni will have to make sure his staff is trained on how to store and handle the virus and how to deal with allergic reactions. He'll also have to cover all costs, which is about $1,000 per location. He's ready, but there's a wait, and it's a long process.
I'm not sure when those supplies are going to be available. I spoke to the state dental director today who said it could be a couple of weeks before we even have access to the vaccine.
White says it's not likely many offices will do the same because of the wait, cost, and the logistic challenges.
Lots of administrative hurdles that have to be cleared, and that's outside the dental board's purview. It's between the dentist and the CDC.
On Friday, the state reported its lowest positivity rate we've seen at any point in the pandemic, 3.7%. Another number going down, testing. The state is reporting a 30% drop in people getting tested for COVID in the last month. Health officials are not celebrating just yet. WRAL's Joe Fisher reports on the effort to keep testing going in Wake County.
Wake County offers COVID testing at 9 locations, but one look at this parking lot and you'll notice demand is low.
We have seen a significant decrease in our testing.
A 40% drop since December.
People are exhausted of COVID. People are excited and preoccupied with vaccines.
Eugene Chalway is Wake County's mass testing operations manager. At its peak, the county vaccinated 12,000 people on some days, which has dropped to about 2,500 daily tests. The decrease is happening statewide. In early February, about 49,000 people got tested per day, with 7% of tests returning positive. In the last week, however, that's dropped to 34,470 per day, with under 5% positive, a 30% decline.
If we reduce significantly our testing, that number will be suppressed and it won't give us a true picture of what's really going on in the county or even in the state.
While Wake County has permanent sites like the Swinburne parking lot in East Raleigh, pop-up testing is happening in parks, like next week at Biltmore Hills Park in Raleigh, White Deer Park in Garner, and Fred Bond Park in Cary.
Are you convinced at this point that there is less virus in the community?
No, not at all.
Chalway says community testing will continue at least through April. He says even vaccinated people should continue getting tested if they don't feel well, because they too can be carriers of the virus.
It took a lot of hard work to get to this point, and we can just easily lose it, in a matter of weeks.
I'm Joe Fisher, WRAL News, Raleigh.
Thanks for listening, and a little plug here. You can listen to complete WRAL newscasts in podcast form. Subscribe to WRAL News Daily wherever you listen to podcasts. We post 5 newscasts each weekday and 2 on the weekends. You'll get all the news, weather, and sports you would get on television, but in audio form. Just search WRAL News Daily. For the Coronavirus News Brief, I'm Mark Boyle.